My name is Jessica Rowe, and today I will be talking about the social determinants of health in regards to nursing education. Before I begin, I want to talk about one patient that really made me passionate about the social determinants of health. One patient I will never forget was a middle-aged man I cared for while working on a cardiac step-down unit. He had been admitted multiple times for heart failure exacerbations. Each admission seemed frustrating because he understood his medications, could explain his diet restrictions, and genuinely wanted to get better. During one hospitalization, I sat down and talked to him longer than usual. That's when I learned that he lived alone in a rural area, had unreliable transportation, and often had to choose between paying for groceries, medications, or electricity. He told me that some days he skipped his medications to make them last longer and relied on his inexpensive processed foods because fresh foods were too expensive and difficult to access. I remember feeling heartbroken when he said, "I know what I'm supposed to do, I just can't afford to do it." In that moment, I realized his repeated hospitalizations were not caused by a lack of knowledge or motivation. They were a result of the social determinants of health, economic stability, access to health care, transportation, and food security that were beyond his immediate control. That experience changed how I practice nursing. Instead of focusing only on my diagnoses, medications, and treatment plans, I began asking patients about barriers they face once they leave the hospital. Understanding the social factors affecting a patient's health allows nurses to connect patients with resources, advocate for their needs, and create realistic plans of care. It reminded me that excellent nursing care extends beyond the bedside and requires addressing the conditions in which people live, work, and access healthcare. So before I begin, social determinants of health are non-medical factors that influence health outcomes. These include factors such as access to education, quality of education, access to and quality of healthcare, the patient's neighborhood and built environment, social and community context, and economic stability. They have a greater influence on health outcomes than genetics or access to care. This reinforces the importance of addressing the social determinants of health within our healthcare system. In the United States, 37 million people live in poverty. Approximately 1 in 5 Americans live in rural areas. Research has shown that rural Americans face worse health disparities than their counterparts who live in urban or suburban areas. They are more likely to die from the 5 leading causes of death, such as heart disease, cancer, COPD, accidental injuries, and stroke, than their counterparts. Rural Americans also often face higher rates of health disparities due to geographical isolation, which can affect their ability to obtain healthy food and access to healthcare, lower socioeconomic status, higher rates of risky health behaviors such as tobacco use, limited transportation methods, and limited access to jobs. Educating current and future nurses about the social determinants of health is the first step in creating a workforce that is competent and comfortable discussing these issues with patients. Current education standards do not explicitly require nursing students to learn about the social determinants of health. This lack of education can then carry on into the workforce. Current challenges that nurses and other healthcare professionals face when addressing the social determinants of health include a lack of training, a lack of organizational policies that address the social determinants of health, patient distrust, and an inability to meet patients' needs once those are addressed. Frontline clinical staff are most responsible for data collection on the social determinants of health. According to a recent survey, nurses are responsible for collecting the highest percentage of this information. As healthcare professionals, we can advocate for standardized education on the social determinants of health. Nursing education, from an associate's degree in nursing to a doctorate in nursing, should have standardized education requirements to facilitate the student's learning. Research has shown that when multiple teaching methods, such as case studies, practical application, and teach-back methods are used, learning is further solidified. As bedside nurses, we can foster learning through critical thinking, exposing students to situations where they need to address the social determinants of health, and helping them reflect on how each patient's specific circumstances could affect the care they receive. We can also push for organizational policies that address the social determinants of health, for example, by implementing an evidence-based screening tool in admission assessments. Finally, we can foster collaboration with other healthcare professionals to help address areas where patients may lack resources. It would also be imperative to educate nursing students about the importance of collaborating with other health professionals who have the resources to address these patients' needs. Exposure as a student may make them more comfortable addressing these issues as a nurse.